and welcome. I'm Michael Mutterer, Vice President of Patient Care and Chief Nursing Officer at Silver Cross Hospital. At Silver Cross Hospital, we're known for our culture of excellence and for delivering an unrivaled healthcare experience for patients, their families, and the communities we serve. This week, we observe Patient Experience Week, a nationally recognized week designed to celebrate healthcare staff impacting patient experience at all levels of the organization. With me today are Jackie Bowman, our Director of the 4th Floor Cardiac and Telemetry Units, who as a clinical nurse here at Silver Cross is front and center in caring for our patients each and every day. Mary First, our Patient Experience Advocate, and Deb Summers, a member of our Patient Family Advisory Council. So Jackie, let's start with you. Tell us about your role and what inspired you to become a healthcare professional and a nurse in particular.
Well, thank you, Michael. I've always known nursing was my passion. I have a picture in my office from when I was a little girl. I was kind of attending to my brother who was pretending to be sick, and my grandma who was a retired nurse, and my inspiration kind of guiding me along the way. In my 14-year career here, I've played many different roles. I was able to join our Silver Cross team as a CNA, going to nursing school, had many different opportunities, such as our clinical resource pool. I got to float around the entire hospital, get to know different people, see different areas. I was blessed to also take this role as a manager over cardiac and take care of our cardiac patients. And then in January, I was promoted to director, where I kind of helped to oversee and coordinate care to make sure that we provide really great, good quality care to our patients.
Excellent. And you always are one of our top performing units as it relates back to patient experience, so we thank you for that.
Thank you. Thank you.
So Mary, talk to me a little bit about what your primary responsibilities are as a patient advisory advocate here at Silver Cross.
Well, my primary responsibilities are very numerous. They are mostly behind the scenes. I can be working with the directors, the managers, helping the patients. It can be going up and talking with the patients. It can be either while they're here as an inpatient if they have concerns, or once they leave and have concerns. It can be regarding billing. It can be regarding a different gamut of different things that they are concerned with. The best part is when we can try and make a better experience.
Yeah, so my guess is you have a lot of patient contact day in and day out.
Yes, a lot of it is on the phone, but it also is going up and talking to the patients.
Yeah. What's your most favorite part of the job?
My favorite part is making moments, is going up there and working with the staff and doing something that makes their stay a little better, brightens their day.
Great answer. So Jackie, what are the most important qualities you look for when you're hiring a Silver Cross employee, so a new nurse, a new care tech?
Yeah, absolutely. So when I am seeking out a new member of my team, I'm really looking for somebody that's friendly and somebody that I can see the empathy and compassion for. That's really kind of key, because that's our culture here at Silver Cross. Is very unique, and I can teach somebody the skills. I can't teach them how they're going to make a patient feel, and that caringness really goes a long way.
It's so true. That's such a great point that you can teach anybody a skill, but the ability to have that kind heart is something that we have to look for here.
Absolutely,
So,
absolutely.
Great. So Deb, you have been a patient here at Silver Cross for a number of years. So tell me what made you choose Silver Cross and what makes you feel comfortable about receiving your care here at Silver Cross?
It's like a family hospital, actually. We've been here for years. I'm a Jolietan. I've been here for years. Even I was telling Sharon that I even was raised on Joliet Street. You can't get any more Joliet than that. So it just feels like it is the hospital of choice for me, my family, my community, and so pretty much that is why we've chosen it. We're comfortable here. We trust our care that we receive here. So
fantastic. And what is it about Silver Cross that helps you feel that trust in putting your hands or your care in our hands?
Well, to be perfectly honest, you have on Silver Cross staff a number of people that I know, and throughout the community. So it happens that when you have employees, okay, that are happy and content, and the hospital is a family, then it really extends over into the community. And we make choices sometimes based on those relationships that they have and the relationships that we have in choosing where we receive our care.
You know, that's so true, and you touch on another point. I mean, I think there's a lot of research out there that connects happy employees and good employee engagement with good patient engagement or good patient experience. So that was a great connection. So tell me a little bit, Deb, about what you look for most in your healthcare provider. So thinking about choosing a physician.
It varies depending on what the condition is or what I'm struggling with health-wise, whether it be race, whether it be that I'm a woman, whether it be my age. Sometimes I make choices based on that and whether they can relate to the experiences that I'm having. Other than that, if I don't know all of that and can't identify those types of things when making a selection, then I go to my pool of resources as usual. I belong to an organization, a large organization of women, the National Network of Black Women, and we kind of feed in each other. We use each other for resources. So it would be someone that I trust that could make that referral that has had an awesome experience as well. So that's pretty much how how I make my choice.
Sure, great. Great, thanks for sharing that. So at Silver Cross, we use a third-party vendor called NRC that helps us get our data surrounding our patient satisfaction scores, and it's information that we can use here in the hospital to help direct us. So we get to hear the great things that we do, but we also get to hear the areas that we can focus maybe a little bit more attention on. So Jackie, as a nursing leader here at Silver Cross, how do you use that data on patient satisfaction to help drive performance?
Absolutely, we do. Daily, our nurse managers and nurse leaders round on our patients to get in-the-moment feedback, and we kind of encourage them to fill out that survey because it is so important to us. And then weekly, I sit down and I review the data that is in the system. I post comments for the staff. I think the words, that when they hear it from the patient perspective, whether it's a good experience or bad experience, that we can all learn from and move forward. Also, if we're struggling in an area, we usually focus on that. We have a unit-based council that will create projects. One of the projects that came from that was we had an issue with quiet at night. We had heard from our patients that it was just too noisy at night. So we created quiet kits for them. So it comprised of earbuds and a face shield so that they can kind of get some rest while they're in the hospital. So it is truly something that we value.
That's great information and truly does help us create a better patient experience. So thank you. So Mary, while your work may not necessarily be clinical in nature, you referenced earlier when we were talking about creating moments. So can you think of a moment in particular that has been near and dear to your heart?
Yes, there was a patient that had actually come to the hospital, and we learned that she had lost everything in the fire. She even had lost her pet. And it was devastating. And I had gone downstairs and talked to our office coordinator, and I'm like, Z, what can we do? What can we do to help this patient? And she said she had a charm that was a paw print. So we got a item from the gift shop, and we put it on the charm on there with it. And we got her blankets, and we got her clothes from the Encore shop. And other staff even heard about it, and they chipped in and got other items for her. And she was just beyond touched. I mean, we got items, that were toiletry items, et cetera, that were donated, that she would have some items for herself.
Yeah, that truly is amazing. Thank you from the bottom of my heart for really going above and beyond to create those experiences for our patients.
It's my pleasure. It's a team effort. We work, like I said, we work with other members of the team and other departments to make it work.
It is a team effort,
Yes.
That's for sure. So while we're able to get data from NRC, we really wanted to figure out a way at Silver Cross to really get some firsthand information from people that receive care here at Silver Cross. So recently we developed a Quality and Safety Patient and Family Advisory Council, for which Deb, you're a member of. Yeah. And really our focus on that is to be able to get information from people who use us, so who get their care here at Silver Cross, or family members of people who get their care here at Silver Cross, but to really hear firsthand what's worked, what hasn't, what areas we can improve upon, and really take that time to be able to listen. So Deb, as a member of the Quality and Safety Patient and Family Advisory Council, what has the experience been for you? How has it been for the first couple of sessions that we've had?
It's great. I think what's so special about it is it's the transparency, the opportunity to share, and the fact that someone is actually listening, you know, and so it's a very comfortable situation, very comfortable atmosphere in terms of trying to pinpoint whatever gaps there may be and making patients feel comfortable at the hospital.
Yeah, and we truly appreciate that. I mean, it's great to hear the good things that we're doing, but I think what's most important is to have people who are willing to give us that honest feedback that can help us grow in the areas that we may not necessarily get from the data that's collected from NRC. So truly, I appreciate all you've done for us to help us get that Patient and Family Advisory Council up and operational. So Jackie, Mary, Deb, thank you so much for being here today and talking a little bit more about how we at Silver Cross really recognize the importance of that patient experience and really all the things that we can do, both little and big, that can help make those experiences here at Silver Cross as best as possible. So thank you all for being here.
Thank you.
Thank you.
Thank you.
Thank you.